Hello again, class, and welcome to Business 80 Medical Terminology and Anatomy, Chapter 12, the Neurologic System. So let's get into it. So the neurologic system, what does it do? The nervous system coordinates all body movements, okay, or all body functions. Okay, there's two main cell types. The neurons and neuroglia, or neuroglia, however you wish to pronounce it, okay? And then two main divisions of the nervous system. You have the central nervous system, or CNS, and the peripheral nervous system, or PNS, okay? So neurons are the functional unit of the nervous system, okay? So what's their purpose? It's to respond to stimuli and to transmit responses via an electromechanical messaging system. Okay? So axon and dendrites. Axons, for me the best way to remember this is axons conduct nerve pulses away from the cell body. So just like when we talked in the cardiovascular system, we talked about arteries away, veins toward. In this particular one, again, I use away. Axon begins with an A, away begins with an A. Axons away moves nerve impulses away from the cell body, and then dendrites move nerve impulses toward the body. Okay, neuroglia are there to nourish, protect, to keep neurons held together. The ependymal cells line the brain ventricles. Astroglia cells supply nutrients to the neurons. Okay, microglia are phagocytic cells, which basically phagocytosis is a way to remove waste products or waste material. So microglia are phagocytic cells that protect the neurons in part by removing waste from an injured neuron in particular. Okay, so it's kind of like a defense system, a defense mechanism. Kind of like the immune system of the nervous system. Okay, microglia. All right, the brain consists of the cerebrum, the cerebellum, the brainstem, and the diencephalon. Okay, so the cerebrum has two hemispheres, the left and right hemisphere, which I'm sure you guys probably know that. Okay, and then these are the major structures in the brain. So you can see the four main components there, right? The cerebrum, the brain stem, which runs down or leads into the spinal column, the cerebellum, and then the diencephalon, which is kind of in the middle of everything. Okay, so let's see. The cerebellum, has two hemispheres. The outer cortex of gray matter and the inner cortex of white matter. Okay, so what do those things, what do they do? So gray matter is unmyelinated nerve cells, and a myelin sheath is kind of a protective coating or a protective outer coating. So these are unmyelinated. Okay. And then within the cerebrum lie the white matter, or myelinated. Inside the cerebrum are these protected nerve cells protected by a myelin sheath. Okay. All right. Let's see. In the brain, so probably important is in the brain there are 12 sets of cranial nerves, or in the head there are 12 sets of cranial nerves. There are more spinal nerves, 31 pairs of spinal nerves that run from the C-spine down to the sacrum coccyx. So 12 sets of cranial nerves or pairs and 31 pairs of spinal nerves, which I think we're going to talk about here in just a few minutes. The thalamus relays most sensory stimuli, so it's a kind of a relay point. The hypothalamus is for all intents and purposes, I consider it to be like the thermostat, a thermostat on a car, or the thermostat in your house. It helps to control blood pressure. It also controls or helps to control water balance, secretions from the pituitary gland, emotions. Okay, so the hypothalamus does all of those things, as well as the autonomic functions, including the sleep and the wake cycles. Okay. The limbic system, a little bit different, screens all incoming sensory information and initiates the basic drives, human drives, like things like hunger, aggression, anxiety, that type of stuff. Okay? All right. Sensory pathways, so impulses travel by afferent or ascending by an ascending tract, okay, which are afferent nerves, okay, and there's two different things here. There's afferent and there's efferent. Afferent beginning with an A, okay. So afferent, and I kind of want to get to my note here, so hang on a second. Let me see if I can find my note, okay. Let's see. Afferent. Okay, so sensory impulses travel via the afferent or ascending. So afferent begins with an A, ascending begins with an A. Probably a decent way of trying to keep those things together. Okay. These impulses use two major pathways. Okay. So when impulses are traveling away, or afferent, efferent, E-F-F-E-R-E-N-T, are descending pathways. So afferent being ascending, efferent being descending. Motor impulses travel from the brain to muscles, away from the brain, via the efferent pathway. Okay. All right, protective structures of the central nervous system, bones, okay, so things like, your skull, your spinal column, your vertebrae, those are all designed to protect the foramen magnum, where the spinal column runs through the vertebrae in your spinal column. That's to help protect the spinal column from injury. Meninges cover the cerebral cortex and the spinal column. Okay, hence the term meningitis. An inflammation of these meninges can cause severe issues like partial paralysis, full paralysis, possibly even leading to death. Okay, so when meninges become inflamed, that's meningitis. Okay, CSF, cerebral spinal fluid, colorless fluid that cushions the brain. It also transports some nourishment and some metabolic waste away from the brain. Cerebral spinal fluid. We do lumbar punctures or spinal taps to assess CSF health. We will do that for making a diagnosis possibly of meningitis, is to do a lumbar puncture and get that cerebral spinal fluid and then test it for meningitis. Okay. The peripheral nervous system consists of cranial nerves, spinal nerves, the autonomic nervous system, or ANS. So again, we go back to what I mentioned earlier, the 12 pairs of nerves in the brain, the head, the neck, kind of the upper portion, and then the 31 pairs of nerves consisting of both the afferent and the efferent neurons, and that runs from the C-spine down to the sacrum coccyx. Okay. Let's see, sympathetic versus parasympathetic. I like this. Important to know. Sympathetic nervous system or sympathetic nerves cause widespread responses or I guess more full body type responses, where the parasympathetic system targets an organ or a gland, and it's very specifically targeted. Okay. Some of the physical exam terms that we can get into. Let's see here. What do we have? We've got petit mal seizures or absence seizures, momentary loss of consciousness, aphasia, the loss or impaired communication. These are physical exam terms that are focused on the neurologic system. Okay. When we talk about the neurologic system, we talk about things like speech and reflexes and motor function, ability to move, right? Aphonia, the inability to speak. Ataxia, impaired voluntary muscle coordination. What else do we have here? We've got some other ones. Coma, a state of unconsciousness, which the patient cannot be aroused. Dementia, many different forms of dementia. Mental syndrome marked by general loss of intellectual abilities. So we have different types of dementia. They can oftentimes be very difficult to actually diagnose because there are many different types of dementia, okay, such as Alzheimer's is a form of dementia. Okay. Dysphagia, speech impairment characterized by failure to arrange words in a proper order. Okay, so basically it's difficult speech patterns. Okay. Dyspraxia, partial loss of the ability to perform coordinated movements. Okay. This could be possibly a diagnosis that occurs after maybe a stroke, a CVA, or a TIA, a mini stroke, a trans-ischemic attack. Okay. The Glasgow Coma scale is commonly used to assess levels of consciousness. Okay. Hemiparesis, paralysis or muscular weakness affecting only one side of the body. So we consider the body to be two separate hemispheres, a left and a right side. Hemiparesis is the paralysis of one side versus the other. Which is oftentimes is muscular weakness affecting one side. Hemiplegia is paralysis, like significant paralysis, loss of movement of one side of the body. Okay. Neuralgia, severe pain in a nerve or nerves, very common diagnosis for somebody that's exhibiting some form of nerve pain. Okay. Some of the other physical exam terms when we talk about reflexes. A provider will do many different types of movements or tests to try to determine if there is a neurological problem that's actually happening to the patient. Okay, so things like the Achilles tendon reflex, Babinski's reflex, dorsiflexion of the great toe in response to stroking the sole of the foot. That will tell us if there's any nerve damage that's causing lack of movement of that great toe. Biceps reflex, corneal reflex, gag reflex, touching the soft palate or pharynx, producing a retraction of the tongue. Okay, very common to identify gag reflex, right, when we're doing something like a throat culture or a rapid throat culture. Okay. The patellar reflex, okay, the knee jerk, reflex kick that occurs when the patellar ligament is tapped. So we would use like a reflex hammer or reflex mallet for that. Okay. Same thing with the triceps reflex and the biceps reflex. Okay. Some of the imaging studies that we do, angiography, cerebral angiography. Okay. This is where we inject contrast dye or contrast media to visualize the vasculature of the brain. Okay, so that contrast media will light up the vessels of the brain so that we can make assessments on that. CT scans, computed tomography, CT, computer analysis and a radiograph of the tissue density produces images inside the skull and the spinal cord, gives us a much deeper view of what's going on inside you. Same thing for things like MRIs. MRIs creates images of structures. CT scans and MRIs are really useful for neurological issues in the brain, in particular because we can get slices of imaging, especially on a CT scan, where we can see many different layers going toward whatever structure we're looking at, and we can visualize damage that way. Okay. All right. PEGs and PETs, probably a PET scan is probably, to me, is probably the most common, a positron emission tomography. Okay, it's a study used to determine the brain's metabolic activity after we, again, inject a radioactive contrast dye. Okay, so PET scans are fairly common. I think much more common than the PEG scan, where that visualizes fluid-filled structures of the brain after CSF or cerebral spinal fluid has been withdrawn through a lumbar puncture and replaced by air, helium, or oxygen. Okay. Let's see. Other things, EEGs, electroencephalography, we see those fairly frequently or perform those, which is a record or recording of the electrical activity of the brain. Okay. CSF, we already discussed that one, lumbar puncture or spinal tap to get that CSF fluid. We can look for many different substances. I like this one, the amyloid beta protein test. Amyloid plaque is, or a buildup of amyloid protein, we believe is partially responsible for Alzheimer's. Okay, and this one does say that we check the CSF for levels of a substance that produces the protein plaques seen in the brains of patients with Alzheimer's disease. So pretty common test now that's used and aids in a successful diagnosis of Alzheimer's. Okay, CSF analysis, okay, to detect the presence of blood in the cerebral spinal fluid, infections, meningitis. Okay, brain and spinal cord disorders, cerebral palsy, chronic disorder of motor function, okay, from non-progressive brain damage. Okay, so non-progressive, so meaning that brain damage doesn't continually get worse or worsen. It's like a permanent brain damage that's caused motor function loss. Okay, epilepsy, uncontrolled electrical discharges from the cerebral cortex, characterized by things like seizure. Okay, which can be life-threatening in severe cases. Grand mal seizure, okay, would be one. Hydrocephalus, excessive CSF within the brain's ventricles is hydrocephalus. Okay, subdural hematomas, accumulation of blood in the subdural space, fairly common. Migraine headaches, very common. Okay, and oftentimes exacerbated by things like photophobia, or come with signs of photophobia and possibly nausea. Photophobia being sensitive to light, okay, and that can make a migraine worse. Okay, CNS infections, abscesses, right, collection of pus in the brain, encephalitis, inflammation of the brain. Okay, myelitis. So if we think of that myelin sheath that covers the spinal column, myelitis is the inflammation of the spinal cord, or the sheath, the protective sheath that covers the spinal cord. Meningitis, inflammation of the meninges of the brain and the spinal cord. Okay. Poliomyelitis, acute viral infection, inflammation of the gray matter of the spine caused by the polio virus. Don't see that very often, thanks to pretty diligent vaccine administration with the injectable polio vaccine. Okay, rabies, usually fatal viral infection of the central nervous system, which is spread by animals, in particular rabid animals, rabid dogs, raccoons, coyotes. Okay. All right. Neural tube defects are serious birth defects that involve the spine or the brain. We talked about those in chapters 10 and 11, I believe, where we can do an AFP, an alpha fetoprotein, or a triple screen blood test to look for possible neural tube defects during pregnancy. Okay. Let's see. Spina bifida, spina bifida cystica, and meningocele spina bifida. Excuse me. Those are two different things. And I like what we're in spina bifida cystica, incomplete closure of one or more vertebrae, which causes the spinal contents to protrude in an external sac. Okay, so this isn't fully developed vertebrae, okay, that contains the spinal column or the spinal cord, and it allows it allows the spinal cord to protrude where into spaces that it shouldn't be. Okay, and I like how it says the spinal cord is usually normal. It's just that protective mechanism of having fully formed vertebrae isn't there. All right, cranial nerve disorders, Bell's palsy, very common. Unilateral, usually just one side, facial paralysis, usually with sudden onset. Okay, it says it's attributed, we believe, to a lesion of the facial nerve, oftentimes mistaken by patients initially as having a stroke. Usually Bell's palsy resolves itself in most cases, so you may have partial one side facial droop and paralysis, and then that goes away over time. Trigeminal neuralgia, okay, painful disorder affecting one or more branches of the trigeminal nerve. Okay, and it's that one. I'm gonna check a note here. Okay. Let's see. With stimulation of a trigger zone, the patient experiences paroxysmal attacks of excruciating facial pain. Okay, trigeminal neuralgia. Degenerative disorders, things that worsen over time. Alzheimer's disease. Probably one of the worst things I would wish upon anybody is, which I don't wish upon anybody, but one of the worst things I think can happen is for anybody is Alzheimer's disease. And in particular, it affects the family and close friends much more than it does the patient, because the patient doesn't, at some point during the process, doesn't understand or realize what's happening. And in essence, we watch the essence of that person literally just disappear. I'm sure many of you in class have experienced a family member, a loved one with Alzheimer's disease. It's an unpleasant experience for family. Okay. Let's see. Huntington's disease, fairly common to see this hereditary disorder that causes degeneration of the cerebral cortex and the basal ganglia, okay, which leads to chronic progressive jerky movements and some mental deterioration. Amyotrophic lateral sclerosis, commonly known as Lou Gehrig's disease, is a progressive degeneration of motor neurons. So ALS, usually life expectancy with ALS is not very good. This is another one of those that I think if we looked it up real quick, I think we would find the 5-year mortality rate is probably around 5 to 10% from time of diagnosis. So very debilitating loss of all muscle function in ALS. Multiple sclerosis, very common diagnosis, progressive demyelization of the white matter of the brain results in weakness, malcoordination, paresthesias, speech disturbances. Okay. Parkinson's disease, slow progressing, degenerative disorder that affects muscle rigidity. You can have involuntary tremors and involuntary speech patterns with Parkinson's disease. Okay. Head trauma. So trauma, obviously, very important to try to protect your head. This is why we wear helmets when we, ride a motorcycle or ride bikes. Cerebral contusions, bruising of the brain tissue after a severe blow to the head. Okay, concussion results when a blow to the head causes the brain to strike the skull, causing temporary neural dysfunction. Okay, so the brain striking the skull or hitting the bones of the skull. Okay, not good. Okay. Epidural hematomas, we see these frequently enough. Rapid accumulation of blood between the skull and the dura mater. Okay, vascular disorders, things where we have decreased or increased potential blood flow or activity of blood in the brain. Probably cerebral aneurysm is fairly common, localized dilation of the cerebral artery caused by weakness of the artery wall. And then cerebrovascular accident, or a CVA. A CVA is a major stroke, okay? Usually caused by a thrombus, a blood clot, or a clot that breaks and travels, which would be an embolus, or a hemorrhage of the cerebral artery, okay? Bleeding out of the cerebral artery. So CVA is a major stroke. A TIA, trans-ischemic attack, or transient ischemic attack, okay? Neurologic deficit without permanent brain damage that lasts less than an hour typically. These are like mini strokes. They can be precursors to having a CVA. So I kind of liken it or think about it in terms of a TIA is almost like a foreshock. We live in Southern California in fairly earthquake heavy activity zone, right? And sometimes we have foreshocks before a major earthquake. A TIA is basically can be construed as a foreshock to a CVA, or a major stroke. Okay, miscellaneous neurologic disorders. If anybody's received a flu shot recently, I did today myself. Guillain-Barré. Acute febrile polyneuritis that occurs after a viral infection. Okay, so multiple nerves are usually affected by this, characterized by paralysis that begins peripherally, so from the outside, and moves centrally. This is a common question asked before we give a flu shot, if you've ever encountered Guillain-Barré. Okay. Neurofibromatosis, hereditary disorder characterized by multiple fibrous tumors of the peripheral nerves and the skin. Reye's syndrome, acquired encephalopathy seen in childhood, strongly associated with aspirin, and that's why we tell parents not to give adolescents and infants aspirin, because this could develop into Reye's syndrome. Okay. Tetanus, commonly fatal illness caused by Clostridium tetani, okay, which usually enters the body through a puncture wound. So we think about that as because we naturally find this occurrence in soil and stuff. So that's why we say you step on a rusty nail or something like that. We definitely want to get a tetanus vaccine on you fairly quickly. We don't see many incidents of this, again, thanks to successful administration of tetanus vaccines. And Tourette Syndrome, characterized usually by facial or vocal tics, lack of coordination, can be very debilitating if the tics are really bad. It can cause people, and when we say tics, we're talking about involuntary movements. okay, or verbal or vocal tics, okay, where things come out of people's mouths that maybe shouldn't come out of their mouths. That happens sometimes, okay. What are some of the treatments? Some of the treatments that we see, craniectomy, removal of part of the skull, hemicraniectomy, removal of part of the skull to expose half the brain for surgery. I've seen this once in what we call an awake surgery for a gentleman who was having a brain tumor removed as much as possible, where we basically remove the skull cap, use a general anesthesia to put them out, cut the skull cap, remove that, and then wake them up, so that when a doctor is cutting a tumor away, we can monitor different nerve centers that tumor is close to make sure that we don't do any further damage, like to the vocal centers or to muscular centers. Okay. Lobectomy, removal of the lobe of the brain. Okay. Lobotomy is an incision into the lobe of the brain. Okay. Other things we do, let's see, ventricular catheters, fairly common. Catheter that's inserted through a burr hole into the lateral ventricle of the brain. Okay. And that's in order to drain fluid or blood. Okay. We do spinal and nerve surgery, common enough. Neurectomy, removal of part of a nerve, possibly a nerve that's been damaged. It can't be repaired. Okay. Neuroplasty is surgical repair of a nerve. Plasty is repair. So anytime you see that as a suffix at the end of anything, that means whatever came before it was repaired. Rhinoplasty is probably the most common one that you would hear. Nose job or surgical repair of the nose or surgical reconstruction of the nose would be rhinoplasty. Okay. Let's see. Other things, drug therapy, anticonvulsants, for seizures, so anti-seizure medicines, corticosteroids to decrease inflammation and swelling. Okay. Antibiotics, of course, to treat infections. All right. So that does it.